When I look at my experience in the Canadian context and my experience in the New South Wales context and in Australia more broadly, there are lots of commonalities between those systems that I would like first to emphasize. We're talking about systems that have a very big, public sector component with universal coverage of many of the services. We're talking about, big landmass with sparsely populated areas, the challenges of rurality, recent migrations, as well as, having a sizable proportion of Aboriginal people that all have specific needs, all have specific systems to try to respond to their needs. And that's something that really New South Wales shares with many of the Canadian provinces. However, there are differences also that I want to highlight. First of all, I think that there's a very strong organization of the knowledge support for the system in New South Wales with the pillars. It is increasingly recognized as something that is quite outstanding. To really have structured the knowledge and independent assessment and support that ministries and local district needs to improve quality, to have structured it in the way the pillars have been structured has been recognized as something that really is a strength of the New South Wales health system. It's not that this is absent in the Canadian context, but it's not as formally structured so that we clearly understand the role and how those organizations can work together. So that's a key strength, I think, that's present. I can sense a strong mobilization of local districts towards quality improvement also, and with regards to the work of the Bureau of Health Information, an increasing commitment to use this information for quality improvement, use it in performance assessment at the local level, safety reviews, etc. And that's something that's extremely positive. It's not something guaranteed, and it needs commitment of managers, policymakers, and clinicians to make this happen, really as part of the culture of performance, transparency, and quality improvement. And I would say that's something that's really strong at the moment in New South Wales. The fact that there's a big private sector is a big difference that needs to be highlighted as well. In terms of medical provision of care, it's a much bigger sector than what we find in the Canadian context. This provides challenges in terms of measuring performance of public sector hospital, obviously. You need to understand how is this public sector interacting with the private sector that provides certain types of services, but not all the services. Really understanding that the public sector hospitals remain, the broad organizations covering all of the needs of the population, but then for certain types of procedures, the private sector plays a very important role. So how is this influencing performance in terms of measurement, and how is this influencing performance in terms of quality improvement? I think is something very different. In Canada, because of the relative absence of the private sector in terms of medical provision of care and hospital care, I would say that things are a lot clearer in terms of coverage of the population needs, in terms of understanding efficiency also in the system. But those challenges are part of the those that we face at BHI in terms of measurement, and we try to engage with the system to understand really how is this impacting on our measurement, so that again we provide an information that is valid and useful for people to act on.